Hi, thank you for tuning in to our faculty development on teaching. This lecture is the miniature lecture on how to teach in clinic. My name is Fran Collichio, and I'm a clinical professor of medicine in the Division of Oncology at the University of North Carolina, Chapel Hill. Let's begin with a case. Our case is our fellow whose name is Mary, and she just started her fellowship training at the University of North Carolina. She's assigned to a clinic at Easttown, and on the first day of clinic, the attending physician says to Mary, just go in and start seeing all the patients. Many of the patients are new to clinic. Several days later, the associate program director gets an email from Mary asking that she be reassigned. What has happened here? Why has this clinic assignment for Mary gone sour? To be an effective preceptor in the outpatient clinic, you need to go through 5 steps. The 5 steps are that you need to set expectations for the trainee. You should have a curriculum. You should perform the activity with the trainee and do ongoing coaching. You should reflect on what has happened and then provide feedback. So for Mary, there were no expectations provided. She was simply thrown into clinic and told to see the patients. For clinic expectations, some of this may sound quite obvious, but for trainees who are going in and out of multiple activities at multiple different times, they're not so obvious. You need to tell the trainee where and when to meet, and specifically how long they will be in the clinic. If you have a clinic that lasts from 8 to 5, but you want the trainee there from 8 to noon, tell them. Tell them how many patients that you expect for them to see. And tell them how much time they have for each patient. Of course, some of that can vary. The encounter may have gone more complicated than anticipated, but give them a rough expectation. Also, let them know what you expect for their notes. Should the notes be completed that day or the next day? And what is the note template they need to use? Provide them with assignments for reading before and after clinic. And then build upon your expectations depend on the level of the learner and the length of the rotation. Before going further, I want to point you to the UNC Academy of Educator website, where there are 3 modules in video format, which also supplement your learning for this activity. There is one on setting an expectation, there's one on providing feedback, and there's one on efficient clinic visits. That one might be particularly important because it shows a different way of setting up the clinic visits than I have described. Let's talk about my example, and let's talk about it in the context of a trainee who's spending 1 day with you as the clinic preceptor versus coming in once a week for 6 months. What's the difference? So for the trainee that comes for 1 day, you still need to determine which patients the trainee should see. And that is the same for the 6 months. The person for the 6 months may want you to say the same patient over and over again if the patient comes for multiple visits. Plan on a reasonable number of patients, and that number may increase with time. Go over the main teaching points that you expect the resident or fellow to learn. This is regardless of whether it's 1 day or 6 months. Provide the coaching. There can be incredibly important coaching opportunities even in 1 day. There's the opportunity to show pieces of the physical examination or the way to speak to patients and families. And at the end of the 1 day, ask for reflection by the resident or fellow on how it went. Now, of course, if it's 6 months, there should be some more formalized feedback. It should be formative in the sense that helping the trainee develop as a physician. And there's usually written feedback sent to the program director. There's also an incredibly good set of resources from the Alliance of Academic Internal Medicine. The clerkship programs have the 4th edition, which has been updated to 2019. And there's a primary care toolkit also on that website, and I show the HRL below. And from our own Department of Medicine, there are awesome videos on the opportunities available in primary care at Easttown with the director of the clinic leading the video, Dr. Kimmel Scott. And there is a photograph showing that during the day, the curriculum is discussed in a multidisciplinary venue. So curriculum. So how do we do curriculum for one day versus 6 months? No matter what activity your residents and fellows are doing, there is something for them to learn. For the residents in the Department of Medicine who rotate in the oncology clinics, we have a video library, and we give them time so they can access those videos. For our fellows in oncology, we set them up for the American Society of Clinical Oncology e-learning. They have didactic lectures, and there are disease-specific reading lists. Now, for formative feedback in the outpatient rotations, for our residents in oncology, there is no feedback. They're just spending one day with us, so it's all about coaching. For our fellows, it's based on the ACGME milestones. For those of you who are then precepting fellows in your clinics, it's really important for you to know what they are being judged on. This is just the example in the oncology clinic, but please find out what forms you're using for general medicine, for rheumatology, for ID, or whatever walk of medicine you're in. For oncology, we have many subspecialty sub-competencies that we are looking at for our trainees. We also teach our faculty that there are learning objectives on MedHub for each rotation that our fellows are in. And we teach our faculty that it's very important when they go to MedHub that they click on a button so they can see all the words that describe the activity for the trainee and their outcome. So let's pause for a minute and just go over what we've just discussed in this miniature lecture. Model educators approach teaching with a conscious plan. They set their goals at the beginning and they give feedback along the way. So this is regardless of whether you're in a classroom setting, in the clinic with your trainee, or on the wards. We are all teachers and we have to follow these steps. The 5 easy steps are to set expectations, provide the curriculum, perform the activity with the trainee, reflect on what you've done, and provide formal feedback for those activities which are longer than one day. I thank you for tuning in to our miniature lecture and have a good day.